Since 2008, Parkview Center for Weight Loss has helped thousands of people reclaim their lives. Our program is led by the center's medical director, Dr. Douglas Cron, a fellowship-trained, board-certified bariatric surgeon. Dr. Cron has performed thousands of bariatric surgeries with complications below national averages and weight loss above national averages.
Hi, I'm Dr. Douglas Cron, bariatric surgeon, president of Western Bariatric, and also medical director of the bariatric surgery program here at Parkview Community Hospital. Overall, within our practice, we've managed approximately 12,000 cases. I've been directing the program here at Parkview Community Hospital since about 2005, so roughly 15 years. Personally, I've performed somewhere between 6,000 and 7,000 surgeries.
Obesity is a serious disease that affects over 40% of the population. It's caused by genetic and environmental factors and is quite often difficult to control through diet alone.
Obesity is a chronic disease of excess fat that's deposited throughout the body, and depending on who you are and what your genetic makeup is, it can be deposited in several different locations.
Obesity is associated with additional health problems that can decrease your quality of life and lead to life-threatening illnesses.
Weight loss does a number of things that are really positive for a person. Helps them to feel better, helps them to look better, restores their confidence. On average, it depends on the operation and the size of the patient when they come in for surgery. But gastric bypasses, on average, those patients will lose about 70% of their excess weight. Sleeve gastrectomy, 60 to 65% of their excess weight, and that weight loss is incredibly helpful for the patient's improvement and their quality of life. And of course, disease resolution is the other thing that we measure our success by, and that's diminishing the amount of medications a person needs to take for their disease. I don't want to underestimate the importance of the weight loss. The weight loss achieves improved physical look, which is important for patients to feel better about themselves and have a higher degree of confidence, and certainly it has a tremendous benefit on mobility and restfulness, and really that is a big part of the quality of life improvement.
Weight loss surgery treats more than just the disease of obesity. It can potentially resolve other conditions like diabetes, heart disease, high blood pressure, joint pain, acid reflux, and infertility.
Diabetes has, in gastric bypass patients, about an 85% overall resolution rate. That's significant. Nothing in medicine provides that. We see resolution of sleep apnea, 70 to 75% of the time, improvement of hypertension, resolution of struggles like infertility, improvement in joint pain. Some patients who are considering orthopedic joint replacement don't have to have their joint replaced, or they can delay that. Or when they do have their joint replaced, we know it lasts longer because we've taken the weight across the joint away.
Bariatric surgery has also been proven to reduce the risk of death from cancer, diabetes, and heart disease.
Weight loss is the single most important thing or beneficial thing that a person can do for their own health and that a practitioner could provide for their patient. It's just a significant number of medical benefits in addition to a huge improvement in quality of life.
Parkview has been recognized as a Blue Distinction Center for Bariatric Surgery by the Blue Cross and Blue Shield Association, and it has received accreditation by the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program for meeting rigorous standards of quality and patient safety.
Our center is credentialed by the American Society for Metabolic and Bariatric Surgery, which is now a combined and joint effort with the American College of Surgeons. So that accreditation guarantees a certain level of services provided and quality and outcomes that are measured and reported to the organization. That happens on an ongoing basis throughout the year, and we have site visits every 2 years. So when you have an accreditation like that, you know that you have met standards that are at or above national averages.
If you've tried traditional attempts at weight loss without success and have decided to explore bariatric surgery as an option, you'll have plenty of questions about what that process looks like.
Well, there's initial evaluation, which essentially is a medical evaluation psychological evaluation, and a nutritional or dietary evaluation. So we put those three things together to assess candidacy.
At Parkview, we walk alongside you every step of the way, helping you to prepare for surgery and providing you with support and resources after your operation for as long as you need them. We take a multidisciplinary approach to bariatric care, providing our patients with a dedicated staff to assist you through the various steps of your journey. Your first step on the journey is to attend an informational seminar where one of our physicians will explain the types of surgery offered and provide you with information to help you make an informed decision.
We perform a myriad of weight loss surgeries. There are kind of two core surgeries that are provided to patients in today's environment, and that's been true probably for the last 10 years at least, but gastric bypass certainly is a mainstay, but the one that has been performed in greatest number recently in the last probably 5 to 6 years is sleeve gastrectomy. Both procedures performed laparoscopically.
Next, you'll meet with our team, who will help you prepare for surgery and adjust to a new way of life and health after surgery.
The National Institute of Health has given us some criteria that we use as guidelines to see who is eligible for bariatric surgery, and those essentially are BMI, which is a measure of size. BMI is a measurement of size, height over weight, squared. If your BMI is between 35 and 40 and you have either hypertension, diabetes, or sleep apnea, then you're a candidate on the medical side of the evaluation. If your BMI is 40 or more without any of the comorbidities, you are a candidate from the medical side of the evaluation. The amount of weight that a person needs to lose before surgery depends on who you're asking. In general, in our practice, we like to see everyone lose some weight, and that amount is different. It's very individual. It's prescribed to each patient depending on what their needs are when we evaluate them in the office. So we have patients come in and they weigh 850 pounds. I've had patients come in at 1,100 pounds, and I've had patients as light per se as 180 pounds, and all, believe it or not, are candidates for surgery. So the weight loss prescription preoperatively is going to be different for the 800-pound patient compared to the 240-pound patient, let's say. But then, of course, there's typically a requirement that a person has tried some medical weight loss management, trying to resolve the concerns or the medical condition with less aggressive techniques. And we also like to see them increase their physical ability, their physical stamina. If we can improve the cardiopulmonary function before they undergo anesthesia, then in general they have an easier time recovering from anesthesia, a shorter length of stay, and a more rapid bounce back after surgery. By and large, those are the criteria, and we find that if patients do not pursue surgery, they remain overweight, and their death rate rockets to 10 times higher than those treated with surgery. A very impressive and surprising statistic, but that's because the medical management is rarely successful and not sustainable.
Every person on our team plays an important role in your weight loss journey.
I think the reason that a person should choose Parkview Center for Weight Loss is because we have a tremendous amount of experience doing this. We've been accredited since the beginning years of accreditation, which in my memory is about 2007 or 8. And I've been directing the program since about 2005. So this program has been in existence for about 15 years now. And I mentioned earlier our volume of experience. You know, it's measured in thousands of cases, in several years' experience between all of us surgeons and providers that have been taking care of patients and doing bariatric surgery. So number one is clearly the experience that we have, not only on our team's side, the providers, but also on the team of anesthesiologists, the team of nurses that are inside the OR, that are in the recovery room, that are also on the patient care areas of the floors. And there are some niceties, of course, as well. We have a beautifully modeled floor that is exclusive for bariatric and orthopedic patients, and it gives a lot of times the opportunity for private rooms and experienced staff. So those are other important reasons that make a choice for Parkview a good one.
If you're ready to take the first step toward a new beginning, please contact Parkview's Center for Weight Loss at 951-352-5643 or visit www.pchmc.org to learn more. We look forward to walking the journey with you.